Welcome to We Are Valley, a podcast by Valley Medical Center, located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being, and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hi folks, this is Alex McGuire. I'm one of the producers of the We Are Valley podcast and your host for today's episode. February is American Heart Month, and we thought that this would be a great time to bring you an episode focused on heart health. So I'm excited to have Dr. Kenneth Igbalode here with us as our guest today. Hi, Dr. Igbalode. Can you introduce yourself for our listeners?
Hi, my name is Kenneth Igbalode. I'm an interventional cardiologist here at Valley Medical Center Cardiology Clinic.
Okay, so Dr. Igbalode, thank you again so much for joining us today. We're really excited to review some heart health subjects with you in honor of Heart Month. Let's start with the basics. Can you tell us about what a cardiologist does?
Cardiologists are physicians who are specially trained in the prevention, diagnosis, evaluation, and treatment of cardiovascular conditions. These are all diseases which involve both the heart and the blood vessels that give blood to the heart and away from the heart. They treat a wide range of patients from the very young to the very old.
And like you mentioned, cardiologists see a pretty wide range of patients, but since cardiologists are specialists, not everyone sees one regularly. Can you give us some examples of reasons your primary care provider would refer you to a cardiologist?
Some of the most common reasons for a primary care physician to refer a patient to a cardiologist would include chest pain, palpitations, or even a family history of cardiac disease. These conditions and symptoms are such that they need special evaluation and sometimes special tests to exactly figure out what's going on. These symptoms can also be quite vague, and it is worthwhile to see a specialist to ask the right questions and to order the correct studies to figure out exactly what is going on.
Got it. So it might be symptoms you're experiencing, but it could also be factors like your personal health history or family history. If we do get referred to a cardiologist, what are some of the ways a cardiologist determines if a patient has a heart condition?
Some of the diagnostic tests and tools used to assess a patient for a cardiac condition can be broken down into where they are performed. There are many tests that can be performed in the clinic, and there are some that can only be performed in the hospital setting. Some of the most basic tests, which are quite informative, include an EKG or an electrocardiogram. This is a tracing which records the rhythm, the electrical rhythm of your heart. It allows us to learn a lot about the rhythm of your heart and also if there is an underlying cardiac disease. Some other tests that can be performed in an office setting include an ultrasound or an echocardiogram. This is a study which uses ultrasound technology to visualize your heart. We're able to see the size of your heart, all the chambers within the heart, and all the valves inside of the heart. This test gives us enough information to make a diagnosis and to rule in or rule out a lot of major conditions. Within the hospital setting, we have more invasive techniques and tools to make a diagnosis of a heart condition. These include a coronary angiogram, or also known as a cardiac catheterization, in which a catheter or a plastic tube is passed up to the heart and contrast dye is injected to visualize in real time the flow of blood through the heart arteries. With this tool, we're able to determine and look for any evidence of blockages or obstructions, both in an acute setting, for example, a patient who has an acute onset of chest pain, or in a chronic setting where a patient has had chest pain for a while, and this is part of a diagnostic workup. So some additional tools that we have in the office include cardiac rhythm monitors. These monitors are helpful in diagnosing any electrical issues or arrhythmias that patients may have. These are small, tiny wearable devices which go on the chest, and patients can wear them from anywhere from a day to up to 14 days in order to make a diagnosis.
That's a pretty big variety. It's reassuring to know not all tests mean going to the hospital. Moving along to our next question, there's a lot of research that often leads to new treatments and care methods. Are there any recent innovations in cardiology that you're particularly excited about?
Cardiology has a rich history of advances both within technology and procedural care over the past 2 to 3 decades. Some of the more recent advances that I think are very amazing include some of our medical therapy. For example, PCSK9 inhibitors. These are newer medicines which are designed to help to reduce the circulating levels of cholesterol in the blood. Prior to the invention of these medicines, patients relied heavily on statin medicines, which are pills, to help reduce cholesterol numbers. With these newer agents, we are able to reduce cholesterol numbers far lower than we could have with just statins alone. The population of patients that benefits most from this are actually those who already have established disease, meaning they've had a heart attack or they've had a stroke, or patients who are at very high risk for having one of these events, meaning they have a genetic predisposition or a familial inheritance pattern, which drives their cholesterol numbers very high. Another advance within the field is the CT coronary calcium scan. This is a non-invasive way to assess a person's risk of developing issues with their heart in the future. This scan is a CT which looks at the heart arteries and looks for evidence of calcification. Calcification is abnormal in the heart arteries and is indicative of a high-risk state. Once this state is identified, then your cardiologist is able to maximize medical therapy in order to reduce your long-term risk of having any potential heart issues. So I think this has been a real game changer in terms of the prevention aspect of cardiology, and it has actually brought to light in a lot of patients underlying issues which may have never otherwise been discovered.
Yeah, wow, those are both so great to hear about, especially because, like you said, they're preventative, which means identifying and treating problems earlier. That's huge. I know we said it earlier at the beginning of the episode, but part of why we're reviewing cardiology topics today is because it's American Heart Month. Can you talk a little bit more about reasons that someone might need to see a cardiologist? What are some signs or symptoms that you really should not ignore?
So I would say any symptom which is associated with exertion always raises suspicion for a cardiac process. The symptoms that may arise during exertion can include chest pain, chest tightness, or chest pressure, also as well as shortness of breath. Anytime, again, you have these symptoms with exertion, you should talk with your primary care doctor and potentially, based on your risk factors or family history, be referred to a cardiologist for further evaluation.
And then one of the things that I've heard is that symptoms can sometimes differ depending on your sex. Can you describe how symptoms can vary? And then for listeners, I also want to specify that we are talking about sex or gender assigned at birth and not gender identity, because a person's gender identity might not be as helpful in recognizing these differences.
Between men and women, it is known that symptoms definitely differ. Men typically will have more classical symptoms of chest pain or angina, which typically is a heavy weight or a crushing pressure sensation on the chest. Women have more atypical features, which may be anything from shortness of breath to indigestion, abdominal pain, neck pain, or jaw pain.
Okay, so in addition to chest pain, it sounds like it's really important to be aware of shortness of breath, neck pain, abdominal pain, and jaw pain, because they can also sometimes be related and need to be checked out.
There is no difference between men and women in terms of rates of heart attack, but unfortunately women are more likely to die from a heart attack just because they are not diagnosed quickly.
Yeah, that's really interesting to know that the rates are so similar between men and women. It's definitely a good thing to be aware of that there are these other symptoms that could be really serious. All right. And so now that we know what to look out for, I think many of us are probably going to be spending this month on working on keeping our own hearts healthy. What are some good habits folks can make to avoid needing to see a cardiologist?
So some healthy habits that people can do to avoid a trip to a cardiologist include making sure you get plenty of exercise. So when I talk to my patients, I like to counsel them on, first of all, what is exercise? Exercise to me is something that gets your heart rate up and gets you sweating. In fact, there was a recent study that showed that if you were able to do at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise over the course of a week, you were able to reduce all-cause death by at least 20%. Moderate intensity exercise includes things like walking or even weightlifting. Vigorous intensity exercise are things more in line with jogging, swimming, biking, or running. Doing these things daily helps to keep you in a habit and to improve your overall cardiovascular health and fitness.
Wow, so moderate and vigorous exercise for really an hour or two a week can make a difference in keeping our hearts healthy, especially as the weather is starting to get nicer. I think that's a really good thing to keep in mind. And when you break it down, it sounds like it's pretty achievable. 2 hours a week would be what? 6 20-minute walks? So going on a walk every day can have a really big impact on our health. And then getting more specific, let's talk about the scenario where maybe you or someone you love does need a cardiac procedure. What options do patients have at Valley, and does Valley offer any special procedures?
So in terms of cardiac procedures, here at Valley, we pride ourselves on technological advancements and doing what we can to modernize procedural therapies. So for more complex coronary conditions, we now have a couple of devices which allow us to better treat complex disease. These devices here help us to deal with calcification within coronary arteries, which makes standard interventions more difficult. These devices are such that they work to break up the calcium within the blood vessel so that balloons and stents can expand more easily within the blood vessels. Prior to having these devices here at Valley, patients would have to go downtown for their care, but now we're able to deal with more complex cases. Additionally, we have devices which are able to support a heart that is weak. When a patient has very low blood pressure and they're unstable, we have devices which are able to relieve the workflow of the heart and allow the patient to be stabilized so that we can deliver the care that they need.
Yeah, it sounds like there's a lot of ways that these technologies assist cardiologists in treating a wider range of complex patients. That's amazing, especially because that means more folks can get treated closer to home rather than having to be seen for their conditions further away. It's really cool.
All right, well, we've covered a pretty wide range of questions, so I think we'll leave it at that. If you are interested in learning more about cardiology care here at Valley, you can visit our cardiology clinic page at valleymed.org/heart, which we will also link in the show notes. Again, our guest today has been Dr. Kenneth Igbalode. Dr. Igbalode, thank you again so much for chatting with us. Thanks for listening.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.